morning. Our talk today is about the impact of SGLT2 inhibitors in bone health in patients with lupus nephritis. This study is under supervision of Professor Dr. Mohamed Abdel Sobh, Professor Dr. Ihab Wafa, Professor Dr. Amr Hosny, Professor Dr. Mohamed Ibrahim Abulghar, and Dr. Iman Nagi, with special thanks to Dr. Noor Sabah, Dr. Wael Murtada, and Dr. Karim Nabi. This randomized double-blind placebo-controlled trial is a part of a project about the impact of SGLT2 in patients with lupus nephritis, which hold in Mansoura Urology and Nephrology Center. This study is registered in clinicaltrial.gov under this ID. Patients with systemic lupus has a common experience of osteoporosis and increasing risk of bone fracture. A lot of risk factors leading to bone loss in patients with lupus nephritis, such as female predominance, postmenopausal state, vitamin D deficiency, medication like glucocorticosteroid. SGLT2 has shown promising cardiovascular and renal benefits in patients with kidney disease. The impact of SGLT2 in the bone health remains controversial. Some studies suggested that SGLT2 has a negative impact in the mineral metabolism through its action in the proximal tubule, leading to glucosuria, osmotic diuresis, also associated with increasing urinary calcium excretion, decreasing serum calcium, with increasing of sodium phosphorus reabsorption and increasing serum phosphorus, all of this leading to increasing intact PTH and FGF23 and vitamin D deficiency. So, the aim of this study is to investigate the safety and the efficacy of SGLT2 in the bone metabolism in patients with lupus nephritis. It is a prospective single-center, randomized, double-blinded, placebo-controlled trial conducted at Mansoura Urology and Nephrology Center from September 2022 to November 2023. It included 84 patients with lupus nephritis diagnosed at Mansoura Urology and Nephrology Centers with EGFR more than 30. The patient was randomized into 1-to-1, either receiving dapagliflozin group, the study group, were receiving dapagliflozin group 10 mg per day, once daily, added on their medication, or a placebo. The patient in the control group will receive a placebo treatment, the same packaging, taste, color, and taste color of the drug of dapagliflozin. The patient randomized by a computer-generated and stratified according to age and GFR. Clinical examination was performed along with collecting of blood and urine sample for the patient at the start of the study and after 12 months. We assessed the bone and mineral metabolism in this patient using two modalities: laboratory investigation, which included serum calcium, serum phosphorus, total alkaline phosphatase, intact PTH, fibroblast growth factor 23, in association with urinary calcium creatinine ratio and phosphorus creatinine ratio. Bone turnover biomarkers, including bone-specific alkaline phosphatase and B1MB as a marker of bone formation, TRAF5B as a marker of bone resorption, and sclerotin as a bone formation inhibitor. The other modality by imaging by quantitative CT to assess volumetric bone mineral density through the lumbar vertebrae. The baseline characteristic of this participant showing that there was no statistical significant difference between the both group as regard demographic data, disease characteristics, similar median disease duration, several years in the both group, and comparable activity and chronicity between the two patients. Bone turnover biomarkers also showed no statistical significant difference between both groups. After 12 months of the intervention, the key finding including the following. As regarding laboratory data, there was no statistical significant difference between both groups as regarding creatinine, quantitation, EGFR, serum calcium, serum phosphorus, intact PTH, fibroblast growth factor 23, urinary calcium creatinine ratio, and urinary phosphorus creatinine ratio. Also, in the bone turnover biomarkers, there was no statistical significant difference between the both groups as regarding B1MB, bone-specific alkaline phosphatase, TRAF5B, and sclerotin adjusted to the baseline. As regarding quantitative CT, the only positive finding in this study is that there was a better improvement in the bone mineral density in the L3 lumbar vertebrae in the dapagliflozin group compared to the placebo group, with p-value 0.017. In the other lumbar vertebrae and the total bone mineral density, there was no statistical significant difference between both groups. So the key finding in this study is that lumbar 3 T-score improvement significantly in the dapagliflozin group compared to the placebo group, with no significant difference in other vertebral levels or total bone mineral density. This study is the first study to investigate the impact of SGLT2 inhibitors in the bone health in patients with lupus nephritis. We're reviewing the literature. There is no other study that investigating this term in patients with lupus nephritis. Also, we find that sclerostin level and bone-specific alkaline phosphatase, the both also not studied in the patient with lupus nephritis. The strength of this study is that it is the first study to investigate SGLT2 inhibitors' impact on the bone health in patient nephritis patient. It is a prospective randomized placebo-controlled double-blinded single center study. It is a comprehensive assessment of the novel biomarkers, including bone turnover biomarkers. From this study, we will need a long-term studies investigating the effect of SGLT2 inhibitors in the bone health in patients with lupus. We needing a larger cohort multicenter studies. We need to use advanced imaging techniques like high-resolution QCT to assess bone microarchitectural changes. Also, bone biopsy will be important in this patient to assess the histomorphometric changes in this patient. So the conclusion, dapagliflozin had no significant adverse effect on bone mineral metabolism in patients with lupus nephritis over a 1-year period. A mild improvement of L3 T-score was observed in the dapagliflozin group. No other difference in the bone turnover biomarkers or total bone mineral density were noted compared to the placebo. This finding suggested that dapagliflozin may be considered safe for bone health in patient population over a 1-year period. Long-term studies involving larger cohorts were worth to confirm this result and explore the potential cumulative effect. Thank you.